Somebody asked me, how do vets cope with pet loss? Do vets grieve when a client's pets die? What about all these euthanasias? Like, how do you make sense of all that? After nearly 20 years in veterinary practice, this is my experience. Fortunately, most of the time in veterinary practice, it's pretty positive. We have happy dogs like Pippi. That's not always the case. You know, sometimes things go wrong. Animals die unexpectedly. Animals need to be euthanized. There's just emergencies, animals that we just can't save. I don't think a week went by in veterinary practice where I didn't have to perform a euthanasia. Most of those euthanasias, those were older animals. They may have been in pain, they may be suffering. So it really felt, most of the time, that was the right thing to do. Not always. I mean, sometimes these were dogs or cats with owners, they just didn't have enough money. Definitely that was a harder part of euthanasia. You know, euthanizing what seemed to me a relatively healthy young animal, and it was to do with money. And when you do it day after day, I mean, I think you develop a little bit of a thicker skin. Like, you have to learn how to cope with that. But it doesn't mean it doesn't fully affect you. It doesn't mean that it really goes away, nor does it ever become easy. Then I can think back to many clients where we had really complex, involved cases. You got to really know these dogs and cats, like Hipster here. I knew the people really well, I knew the pet really well, and then something happens, like, you know, your dog gets a type of cancer that unfortunately we're unable to treat and or cure, and it comes down to the point where you've exhausted, you've tried everything, then, you know, you've got to make the call as a veterinarian. I think now is the best time to euthanize your animal. He or she is in pain, she seems to be suffering. But it's still hard, especially hard going ahead and doing that. Sometimes animals die unexpectedly. To see these young, healthy-looking animals under anesthesia, say for an elective procedure such as a dentistry, and them dying under anesthesia. Fortunately, that really is a very uncommon event, but like sometimes it happens. And there's just emergencies. Like sometimes there can be a spate of emergencies that are just really serious, and you as a veterinarian, you can't save them. Yes, on one hand, here we are, we can perform these pretty impressive life-saving procedures. You save these animals, dogs and cats. But on the other hand, sure not all. And there we are, and we're pulling out that sodium pentobarbital. So how do you cope with all that? How do you make sense of all that? First, from the point of view of euthanasia, I really tried to keep like what was in the animal's best interest first, right? So if a dog was really in pain, really suffering, and we really exhausted all of our resources, I really thought, like, if this was my dog, this is my cat, this is what I really feel, or what I suggest is the best advice, and that is to have your dog or cat euthanized. But having a dog or cat die unexpectedly during surgery, like that's hard to cope with. I know I went through some of those stages of grief, you know, shock, anger, bargaining, depression, and acceptance, even though I didn't talk a whole lot about it. I don't actually remember being taught much of anything in terms of dealing with pet loss, you know, either as an individual, how clients cope and deal with pet loss, or even you as a veterinarian. It probably would have been beneficial if I talked to my colleagues, perhaps talked to my wife, didn't talk a whole lot about pets dying and how that was affecting me. Definitely at times I would talk to the owners, the pet parents of whose dog or cat had died, especially if I knew them well. Small town, we seem to know most people. I thought I was dealing well with it in practice, and if you're in practice for so long, you've got to find coping mechanisms, like however you best do it, because you just can't do that week after week and not be able to cope and then go in and see clients and do everything else that's needed for practice. So obviously I found a way to cope, but now that I'm no longer practicing, I can see like there's stuff coming up. Now that I'm not practicing, I sure find euthanasia hard. I do not like animals dying at all. We happen to have chickens. I had one chicken. She just stopped eating. She's like, okay, I think she's about to die. Maybe I should speed this up. I'm like, no. Let's just put a heat lamp in there. Let's give her a comfy little bed. She doesn't have to fly outside. I'm going to put water next to her, a bit of food. Sure enough, after about a week of hospice, she seemed to perk up. So this chicken, like, she stayed on hospice, indoor chicken care for a long period of time. And recently, unfortunately, she did die, but she died on her own. She seemed pretty happy. And I don't think I ever would have done that 20 years ago. So my point in all this, especially relating it to personal experience, I think pet loss, it affects many veterinarians much more than many people are even aware of. Meaning if you have a great relationship with your veterinarian, let them know. If they're having a bit of an off day, and maybe they just gone through like a pretty intense euthanasia or an animal dying. So be nice to your vet. Thanks so much for watching this edition of Veterinary Secrets. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.